All right, and we are live. Good morning, good afternoon, good evening, depending on where you are when you're watching this live. This is the voice and the face of Dr. Tolu Olabintan, CEO and founder of Living Spring Family Medical Center here in the beautiful city of Mansfield, Texas. And at Living Spring Family Medical Center, we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. I am very excited to be here again today to be discussing another topic that will help us live long and well. And I will be doing so with the amazing Kelly Johnson. Thank you so much for being here this morning.
It's definitely a pleasure. Thank you so much for having me this morning.
Oh, you're welcome. You're welcome. And today we'll be talking about the phrase, Doc, I wish I had someone to help cheer me on my health journey. And it's going to be a talk with a health coach. So kindly please introduce yourself. Who are you and what do you do?
Sure. Thank you so much. So my name is Kelly Johnson. I'm a clinical lifestyle certified health coach. I currently work with in health lifestyle therapeutics. And I work with patients with chronic conditions such as obesity, type 2 diabetes, sleep apnea, and cardiovascular disease.
Awesome. Awesome. Now, curious minds want to know why do you do what you do? What got you sort of interested in this field?
Absolutely. So I would say it kind of harvests from kind of my background during my education. So classically trained in obesity, I'm a weight loss researcher, and so I would say what kind of got me what I do is because I'm really passionate about kind of helping patients or individuals move to making kind of sustainable lifestyle changes. I really chose this career because I noticed that there was that in the primary care setting, there's, obviously it offers a familiar kind of area for patients with chronic conditions, but sometimes these providers aren't able to really dedicate the time to work with these patients, and they're not really sure how to effectively counsel patients with obesity or chronic issues, and also the lack of resources. So to really combat these challenges in health lifestyle therapeutics, we really implemented what we did is we kind of completed two randomized controlled trials where we really developed our what's known as the in health lifestyle therapeutics model. And what we did is we implemented two clinical trials. It was 12-week studies. We used patients with obesity in the primary care setting. And what our results essentially demonstrated was that weekly health coaching led to 7% of percentage of body weight loss in 12 weeks. From there, that allowed us really to develop, and now we implemented our kind of fully clinical reimbursable model health coaching program that's covered through commercial insurance as well as Medicare. As far as as far as who we partner with in health lifestyle therapeutics, we partner with private practices. We partner with health plans and employer groups to help patients and employees, individuals improve their chronic conditions by making and creating and really harvesting long-term, true sustainable lifestyle changes.
I love what you do, and I'm very happy that you're on our team because I've had a lot of positive feedback from patients. I've seen them, implement a lot of this lifestyle changes and feel empowered. Like they come like, Doc, I'm doing good. I like my coach, and I'm like, that's very good. And I like that you did highlight the fact that sometimes we as physicians don't have enough time to really sit down and dig deep. Okay, what's the cause of issues with weight, or what is the hindrance to implementing some of these? And you're able to do that and empower the patients. It's a win-win. So awesome. Now, for quick definition purposes, who is a health coach?
Great question. So you really have kind of two branches of health coaching. You have an individual, someone who goes kind of through a certified health coaching program. They go through a certificate program, such as the American Council on Exercise. And then you have the other side of the spectrum is kind of the gold standard, what's known as a board certified health coach. And that is essentially it's what's known as the National Board of Health and Wellness Coaches, and it's accredited through what's known as the National Board of Medical Examiners, and it's really kind of the gold standard of health coaching. And really, in order to really sit for that board exam, you have to have an associate degree in any field. You have to complete and go through an approved and accredited training and education program, and you have to complete 50 health and wellness coaching sessions that's really dedicated to coaching facilitation. And so at Health Lifestyle Therapeutics, we've created our In-Health Lifestyle Therapeutics Academy. It's actually one of the 110 approved and accredited programs in the country by the National Board of Health and Wellness Coaches. And really our academy prepares individuals to really sit for that NBC-HWC board certified exam. And in this academy, really what happens is these individuals they complete 6 months of rigorous weekly self-studied live classes and self-studied evidence-based training curriculum, where they really learn the concepts of health coaching techniques such as behavior change theories, motivational interviewing, health education and promotion theories, to really help and create help individuals make true sustainable lifestyle change. So again, it's more of that board certified that really elevates health coaches and health coaching to really kind of help empower patients or individuals to make lifestyle change.
Awesome. Now, and you already touched on this as far as what's health coaching. So for the patient who's watching, it's like, okay, what is that? How do you share? Like, what is health coaching? What does that entail? Like, what should I expect when I sign up with a health coach?
Absolutely. So typically, first off is health coaches use what's known as a patient-centered approach, and they really help patients decide their goals. They create goals. They engage the patient or individual in self-discovery and self-monitoring of behaviors such as diet, nutrition, body weight, blood pressure, blood sugar, right? And they really kind of help patients or individuals increase accountability, as well as provide support and guide them on learning how to implement lifestyle changes to improve their overall health and well-being.
Awesome. Now, so someone's watching, like, okay, yeah, that sounds nice and fancy, but how do you help patients feel better? Because yes, we care about the diabetics, the sugars coming down, but how do you help patients feel better?
Yeah. So as far as how we make them feel better, our goal really as health coaches is really to kind of empower, guide, support the patient or individual in setting realistic goals, action steps that really lead to helping patients make sustainable lifestyle changes. We put the patient or the individual in the driver's seat. We help them create health-related goals and create strategies that help them arrive to these goals to make true behavior change.
And I like the word you use, sustainable. So you help them make lifestyle changes that they can actually live with long term, and they feel better for it. So this is key. Now, what would you say are your biggest success stories?
Absolutely. Thank you so much for asking that question. So yeah, my biggest success story is I had a patient that had, she was on like 100 units of insulin. She had an A1C of 9%, which she came to me seeking to lose weight. She was on 3 blood sugar medications, and I worked with her for over 31 weeks. I'm happy to say she's lost 70 pounds. She's no longer on insulin. She's off all of her blood sugar medication. She's created a nutrition plan that she enjoys, that she can stick with. And that kind of meets her where she's at. She walks on a treadmill for 45 minutes per day. And more recently, she's really incorporated some strength training to increase muscle mass, to maintain her current goal weight that she achieved. So that's probably one of my favorite success stories. I have another patient who was on like 200 units of insulin. His main goal was to get heart surgery. And so he had to lose a significant amount of weight. In 18 weeks, he lost 130 pounds. He created, again, a nutrition plan that he created for himself that he could adhere to. It was focused on higher protein, moderate carb. It was, a little bit lower calories. And then he started walking in the pool. When I first met with him, he couldn't walk 100 yards. After working with him for 18 weeks, he could walk up to 1,000 yards. And something that was remarkable he shared with me is that he was able to, for 2 years, he could never walk down the hallway to go to church for 2 years. And after 18 weeks, he was able to walk down the hallway, and he was just so, beaming with pride and confidence that, through this lifestyle change, these lifestyle changes, he was able to really empower himself and, improve his overall health. And now I'm happy to report he just received heart surgery. He's doing fantastic, and he's more empowered and motivated to continue to make lifestyle changes. We're going to start continuing our health coaching journey again once he's healing up.
Awesome. I love it. And I also can testify to patients of mine who are in the program who have done really well and are happy to get off medications. And they come back and like, yeah, doc, I had to stop that medicine. I'm like, yes, by all means, high five. I don't want you to be on those medications if you don't have to. And I have Mitra, who's with us. Thank you so much for joining. And she asked a very good question. How do you speak to patients to bring them on board with food as medicine or lifestyle changes as medicine and maybe decrease medications? So let's say I've sent you a quote unquote a difficult patient who's like, yeah, let me just try this out. How do you speak? Like, how do you speak to them?
Absolutely. Mm-hmm. So what I essentially try to do is first I try, obviously as a health coach, you're not allowed to prescribe a diet, right? But you're able to co-create a diet plan or nutrition plan. First off, we follow the provider's plan of attack. So if they recommend a certain nutrition plan. So first off, I always start off by asking, tell me a little bit about what your, conversation with your doctor was. Did your doctor tell you to focus on, limiting carbohydrates, to increase protein? What were the things that you discussed? So that's where I first start. Secondly, I calculate I start off with calculating calories. I kind of ask them, what is their current activity level? We have a calorie calculator that we calculate. And then based off that, I kind of ask them what their activity level is. Then I put this into an equation and I'm able to calculate a calorie intake. From there, I ask them, okay, do you want to focus on more lower carb, moderate carb, more whole foods, such as a healthy, balanced diet? And so again, I put them in the driver's seat where they get to make the decision, right? And so through that experience and through that decision making, what we do is then I kind of ask them, okay, what foods do you like and what foods do you not like? Again, meeting the patient where they're at and finding a plan that they can stick with. Because at the end of the day, right, you can, doctors can prescribe a nutrition plan, but guess what? The patient might not like it because it's very restricted. So at the end of the day, what I found that's most helpful is, again, finding a plan and having the patient create a plan that they can adhere to, that they enjoy, that it still includes foods that they enjoy, that they can and that they can include in their lifestyle. Because sometimes when you restrict too many foods that they enjoy, again, adherence goes down. They're not going to, continue the plan. And so again, I think it's like, so trying to really create that mindset and create that mindfulness and create that self-control that, hey, guess what? If you want to have some Oreos, you definitely can have some Oreos, but you got to figure out how you can fit that into your calorie take on a daily basis or a weekly basis to continue to keep moving in the right direction to help you reach your goals. So that's kind of how I, start the process as far as, again, at the end of the day, it's all about meeting the patient or individual where they're at.
They are. That's a very good, very, very, very good highlight. You meet people where they are, and you help empower them to even make decisions, healthier decisions based on where they're at. So this is good. Now I have another very good question here by Mitra. She says, a lot of times they will have family members in the same household. And I get this a lot with patients. Like, I'm trying to eat healthy, but my family members who are not on board with this plan. What do you do in those? Like, what would you advise if the patient is saying, like, yeah, I want to do all this, but it's hard. I have people in my house who want to eat whatever. What would you say?
Yeah, so absolutely. So you're looking at the kind of the environment pillar. So yeah, definitely that's a hard, sometimes that's a challenging piece. What I try to typically do is I really ask the question, how does your family members support you in your journey making lifestyle change? I kind of pose that question to them. It really makes them think. So what I try to encourage patients to do or individuals is really to kind of, again, ask that question, do you support me? Do you support me in making lifestyle changes? How can we, you have to maybe sit down and brainstorm. I encourage them to sit down and brainstorm with their family members. How can, they work together as a team in their whole household to really create lifestyle changes together. Or maybe it's focusing on, one meal. Again, maybe it's breakfast that they're focusing on as a whole. Maybe it's dinner, right? So I kind of encourage them to say, okay, what area, do you struggle with most as far as what meal, and then trying to, create that empowerment and, so I kind of focus on that support aspect. And I ask them, how can I support you in this journey? What resources could you utilize to help you support you in this journey, right? And sometimes, you find that people are sometimes family members are picky eaters. So it's like, okay, what kind of meals, maybe you could go research some different meals that might help you, or maybe maybe I could send you some resources that might help you. So really kind of finding and harvesting, kind of, again, meeting kind of the whole family where they're at and trying to figure out how they can work together and create a lifestyle plan that they can stick with.
Awesome. I tend to tell patients, have a family meeting. Just say, hey, how can we support each other to make healthier choices? And then have that dialogue. It also is a good way of bonding too as a family.
Absolutely.
So, now, next question to you. Are you expensive? Because I have patients who say, Doc, yeah, I know I want to eat healthy. I want to do all this good stuff, but can I afford this? What would you say to that?
Yeah, that's a great question. So at InHealth Lifestyle Therapeutics, right, our virtual health coaching program, lifestyle programs, is covered by commercial insurance as well as Medicare. And that's as long as the provider is kind of registered with NHealth. Now, however, let's say for some reason a person came to us and they didn't have a provider that was an affiliate with NHealth. Currently we have what's known as our current cash-based model of per visit is around $39 per session. Now, to kind of put this into perspective, the current market rate, if you looked at private health coaching or if you looked at other health coaching companies, going rate typically right now is anywhere from $50 to $125 per session. Okay, that is the going market rate. Again, we've created this cash-based model to really kind of, again, meet the needs of individuals. Because again, our goal isn't to price gouge. Our goal is really to kind of create a program that patients love, that patients are able to empower themselves to make lifestyle changes. And so again, we have a really competitive rate to kind of help individuals or patients make lifestyle changes. We try to keep it very cost effective. And is it expensive? $39, $40. I would pay for it, right? That's something, if I'm trying to improve my overall health and I need guidance and support, right? I would pay for it. I think it's worth the investment.
It is worth the investment.
So worth the investment. So, I have individuals that meet with me on a monthly basis and they love it. They love the accountability. They use the cash-based model. They come back every month. They're empowered every month. They set realistic goals and action steps to help them to improve their overall health and well-being. And so definitely, it's a win-win for everyone, right? Like the most inspiring thing for me is when a patient comes back to me or an individual says, wow, I'm off 3 medications. My A1C went from 7 to 5.7. Like that's inspiring. It makes me
I feel better.
Yeah, and they feel better.
It's not just like I feel better, Doc. I'm like, that's it.
More energy. They're sleeping better, right? They're having positive relationships with people, right? They have improved mental and emotional well-being, right? They're, able to exercise more and, right? Yeah, they feel better.
They feel better. I like when the chart looks better, like, the A1C looks good and everything is less red, but more importantly, they feel better. And Ms. Mitra commented, she said $39 is about 6 vanilla lattes. So you cut out on things that are not important and invest because you're worth the investment. So be encouraged for those who are watching. All right, my next question to you. What are some of the biggest challenges in working with patients? And I ask this question just to, for someone who's watching, who's saying like, oh, I don't know if I would be a good fit. Like, can I still talk to you even if I may potentially be a difficult patient or I'm not willing to make some of these changes really early? Like what are some of the biggest challenges you have in working with patients?
Yeah. So in the beginning, typically what we do is we try to identify what stage of change the patient or individual is in, because that's super important, right? Again, you're meeting the person where they're at. And so again, it might take, right? It might take 10 to 12 weeks for them to start making lifestyle and behavior changes, right? Changes don't happen overnight. And that's something, so I really try to be transparent and say, hey, look, let's say a patient, individual, maybe they're trying to incorporate more, incorporate more veggies in their plan. And so it's like, hey, you met that your action step was to incorporate, 1 cup of veggie at dinner on a daily basis. And guess what? You achieved that, right? And that's a small win. And right, so right at the end of the day, what I really try to do is I try to help co-create action steps and goals that where the patients are meeting them. And because if they're meeting those goals, right, that's going to motivate them, that's going to empower them. So again, creating realistic goals that can really help them reach their full potential. And again, and saying, hey, look, you lost 2 pounds over the last week. And that's phenomenal, right? Congratulations, right? You're moving in the right direction. Or, hey, you have more energy, right? Or you went from sleeping 4 hours per night to 6 hours per night. I mean, wow, that's so powerful. And has to be really motivating. And so really, again, at the end of the day, it's all about creating these small changes, these small behavior changes that really lead to the big changes, the powerful health outcome improvements. And so that's what I would say. I would say, like, again, at the end of the day, I think probably the hardest challenge would be that sometimes patients come to me or individuals and they say they want to make these unrealistic changes, right? They want to lose 30 pounds in a month. And I ask them, do you feel that's realistic? And they're like, well, not really. And so then we talk about what is safe weight loss, right? So 1 to 2 pounds per week, that's around, on average 4 to 8 pounds per month, right? That's safe weight loss. And I kind of talk to them about from an evidence-based standpoint. Why don't you want to lose weight too fast, right? Well, number one, you're losing muscle mass, right? And if you're losing muscle mass, then that means you're slowing down your overall resting metabolic rate, how many calories you can burn. And so really I'm educating them and I'm guiding them and I'm supporting them, but I'm using evidence-based kind of techniques to really kind of help them understand, like, hey, this is why we're doing what we're doing. This is why you're doing what you're doing. And just at the end of the day, just again, be patient with yourself. And again, the outcomes are going to get better. And so I just kind of try to keep being supportive, that cheerleader, and just really empowering them and motivating them to continue on. If they're having trouble, let's say they come to you and they had a bad week. All right, I always start off the visit with, all right, what are we celebrating today? And because they want to come to you and they want to focus on the negative, right? I focus on the positive because that doesn't really help the patient or the individual. So I really kind of harvest the successes and really start with that. And that really starts the visit out on a good note. And then, again, focus on, okay, well, let's say you weren't able to, track your calories. Well, why do you feel that didn't happen? Do you feel like your action step was not realistic? Well, why? Again, so I really get at the root cause of why, why are things happening? So.
Wow. You said a lot. And you meet people where they are, you set realistic goals and healthy weight loss. There's a science behind it, and celebrating those little wins that add up to big wins down the line. This is not fruit talk. These are tangible, and you see yourself change for the better, and those things become a habit. So it's no longer a thing to do. It's a habit. It's second nature to you, and it's less work once it becomes second nature. So I love how you help our patients and those who you will potentially help in the future. So this is really, really good. And celebrating wins are big. I've had patients come in. I'm like, oh my goodness, 2 pounds, and they're looking at me like, what's wrong with her? And I'm like, that's big. Do you really understand? Like, well, I don't know about that. I'm like, yes, it is. That's a big deal. 1 pound in 1 week. Another pound another week, or even maintaining the weight. That's also big. So awesome. So now, Kelly, I have people who are watching who are like, man, I like what this guy is all about, and I would love to work with him. So where can people find you? Where can people find you?
Absolutely. So yeah, that's a great question. So if you're a provider or patient listening, what you can do is you can go to our website. It's www.nhealthonline.com/contact. And what you would do essentially is you will fill out the request form, and then one of our patient care coordinators will reach out to you within 24 hours. And in addition, you can also look at, we also have all of our board certified health coaches on our website. You can look at kind of the expertise and kind of the background of each of our coaches to find the best fit for you. So I would encourage you to kind of go look at those and who you might best fit with. So yeah, that's kind of where people can find us.
Awesome, awesome. And at Living Spring Family Medical Center, we do have the in health coaching team as well. So it's really important that if you have a provider, maybe ask them, or you have a physician, I mean, or you have a doctor that you see, you could ask them if their services like this, or they can sign on with in health as well. Of course, if you're at Living Spring Family Medical Center, we offer these services. So we'll be glad to have you sign on with in health as well. Thank you so much, Kelly, for coming. This was amazing. A lot of things were learned, a lot of things were reemphasized. For those who are watching this live, I know I keep doing this late. Hashtag live. And for those who are watching the replay, hashtag replay. And please tag those who could find this information useful, because the whole purpose is to help us live long and well. Thank you, Kelly, so much for coming. I really enjoyed this session.
Thank you so much for your time. Appreciate you having me.
No problem. All right. And for those who are looking for an awesome, passionate, and a thorough family physician in the Mansfield, Texas area or surrounding areas, I am She. Thank you so much for watching. Have a good one.